welcome to Unit 3, Trunk and Thorax. So we will be exploring all of these muscles that are on the structure identification list. Starting off, we see the external oblique. We will call it external abdominal oblique for our exam. So this is the most superficial abdominal muscle. Here we have the internal abdominal oblique. This muscle is deep and runs at right angles to the external oblique. So both of the external and internal abdominal oblique muscles help with trunk flexion and compression of abdomen and laterally bends to the same side. So looking at a deeper layer, we see now the transversus abdominis. You can also write this out as transverse abdominis. It works with the other abdominal muscles to compress and support the abdominal contents. This is important in activities such as coughing, sneezing, laughing, and forced expiration. Looking closely, we see the rectus abdominis. This muscle originates on the pubic crest and inserts on the xiphoid process and costal cartilage of 5th to 7th ribs. This muscle assists with trunk flexion and compression of the abdomen. Looking posteriorly to the body, we have the trapezius. It is divided into the upper, middle, and lower sections. The upper trapezius helps with scapular elevation and upward rotation. The middle helps with scapular retraction, and the lower helps with scapular depression and upward rotation. So also near the scapula, we have the rhomboid muscles, the major and minor. This one here is the rhomboid major, and this one here is the rhomboid minor. Both of these help with scapular elevation and downward rotation. Here is the deltoid. It is divided in 3 parts. The anterior, which helps with shoulder abduction, flexion, medial rotation, and horizontal adduction. The middle helps with shoulder abduction, and the posterior helps with shoulder abduction, extension, hyperextension, and lateral rotation and horizontal abduction. Here is the teres major. This muscle helps with shoulder extension, adduction, and medial rotation. And here we have the teres minor, which helps with shoulder lateral rotation and horizontal abduction. Now here, above the spine of scap, we have the supraspinatus. This helps with shoulder abduction, and infraspinatus, which is below the spine of scap, which helps with shoulder lateral rotation and horizontal abduction. Have the levator scapula, which helps with scapular elevation and downward rotation. Also on the scapula, we have the subscapularis. You can find this muscle in the anterior view of the scapula. This muscle helps with shoulder medial rotation. This is a great view to see the subscapularis. Looking at the back of the body, we see the erector spinae muscle group. You can think of I Love Spaghetti to remember these muscles. Iliocostalis, longissimus, and spinalis. So starting laterally, we have the iliocostalis. This primarily attaches to the ribs posteriorly. Because of their position, they are excellent at lateral bending. Acting bilaterally, they are effective extensors. Now here is the longissimus muscle group. This also laterally bends to the same side when contracting unilaterally and produce extension when contracting bilaterally. Now we have the spinalis muscle group, which is most medial, and they are the prime movers in trunk extension. Let's now look at an anterior view of the body. Here we have the pectoralis major, which you can see originates along the sternum and the clavicle. and it inserts on the humerus, creating a medial pull. This makes it effective in adduction, medial rotation, and when elevated to 90 degrees, horizontal adduction of the shoulder joint. Here we have the pectoralis minor. This helps with scapular depression, protraction, downward rotation, and tilt. And over here, we have the serratus anterior, which helps with scapular protraction and upward rotation. Here are the external intercostal muscles, which originates on the rib above and inserts on the rib below. These muscles help elevate the ribs during inspiration. Deep to that, we have the internal intercostal muscle, which is opposite and originates on the rib below and inserts on the rib above. This muscle helps to depress the ribs during expiration. Here we have the diaphragm muscle. This muscle is a major muscle of respiration and plays a role in inspiration. Here is a superficial muscle, the latissimus dorsi. This muscle is a strong agonist in extension, hyperextension, adduction, and medial rotation of the shoulder. Here we have the serratus posterior inferior. This helps to draw the lower ribs backward and downward. Here we have the serratus posterior superior. This helps to elevate the upper ribs. Here we have the quadratus lumborum. This originates on the iliac crest and inserts on the 12th rib and transverse process of all 5 lumbar vertebrae. This muscle also helps with lateral bending. Here we have the intertransversari. These are tiny little muscles and they originate on the transverse process below and insert on the transverse process above. They help with neck and trunk lateral bending to the same side. Here we have the interspinalis. These are tiny little muscles that originate on the spinous process below and insert on the spinous process above. These muscles help with neck and trunk extension. Here are the transversospinalis muscles, which originate on the transverse process and insert on the spinous process of the vertebra above. They help to bilaterally extend the neck and trunk and unilaterally rotate the head, neck, and trunk to the opposite side.